Dr. Budoff, how do you stop carpal tunnel from getting worse?
It's unfortunate, but the natural history of carpal tunnel syndrome is to progress over time. If you leave it untreated, the natural history is that it will get worse. It can be slow, sometimes it can be fast. You don't notice it initially, and then all of a sudden, you're up at night and it's bothering you. Your hands going numb, you can't sleep, and it can get rapidly progressive. And some people, often depending on the genetics behind it, um, sometimes it can progress pretty rapidly to where the hand is constantly numb and you're dropping things and clumsy and weak. Other times it can take years.
Do steroids help treat carpal tunnel syndrome?
Steroids don't really treat carpal tunnel syndrome, but there are definitely reasons to do a steroid injection. Um, if you have an obvious case of carpal tunnel syndrome and the nerve study shows you have carpal tunnel syndrome, then the steroids don't do anything except maybe let the carpal tunnel progress without you knowing about it, which is not such a great thing. But if the nerve study is negative, and it is negative 20 to 33% of the time, especially in early carpal tunnel syndrome, you have it, but it's not yet picked up on the nerve study because, it's not a perfect test. Basically, it's like if you go to the dentist and your mouth hurts and he numbs the tooth and the pain goes away, that's the tooth. It confirms the diagnosis. Same thing here. What I'll do is I'll do a steroid injection, see the patient back in 2 weeks. If the injection helps the numbness of the hand, then that is more accurately a predictor of carpal tunnel syndrome than a positive nerve study, and that's great information.
Is exercise...
Let me go back for 1 second. I forgot one thing. If you're pregnant, we're not going to operate and do a carpal tunnel release. And pregnant ladies, unfortunately, the fluid shifts, they get into carpal tunnel as well as the rest of your body, and they lead to worsening of carpal tunnel syndrome or new onset of carpal tunnel syndrome. Then you're pregnant, you're feeling all those effects, and you can't sleep at night, making it even worse. So I can inject the carpal tunnel in pregnant ladies, and oftentimes that'll take care of it until they give birth, at which point there's 50-50 if it goes away on its own, in which case you're great, or it doesn't go away, in which case you can get it treated surgically and get it taken care of.
All right. Is exercise or ball squeezing good for carpal tunnel syndrome?
No, carpal tunnel is a space problem. It occurs right here. The nerve gets pinched by this ligament called the transverse carpal ligament, and it gets unhappy with that, and you get numbness of the hand, wakes you up at night, bothers you with grip, which increases the pressure in the carpal tunnel. So gripping, like driving, holding a hairdryer, makes the carpal tunnel worse. So ball squeezing could also make the symptoms worse. Exercises, again, gripping things or doing exercises may make the symptoms worse. They don't really help.
Can I fix carpal tunnel syndrome naturally, or does it go away on its own?
It doesn't go away on its own. There's nothing natural. I mean, there's a lot of snake oil salesmen out there. They're thinking B12, lasers, all this stuff has been debunked. It is a space problem. You need to increase more space for the nerve. So we all sleep sort of in the fetal position with our wrist flexed down. That pinches the nerve on top of the carpal tunnel, which has already pinched the nerve, so now it's double pinched. So wearing a splint at night, try that for 4 weeks and see if that works. That can oftentimes buy you some relief, sometimes for a number of years. There's nothing naturally that's going to do that. Now, you can temporize it with an injection, again, if you're pregnant, but really you need to do something when it gets to the point where it's driving you nuts and keeping you up at night, or the hand is constantly numb, and you got to increase the space, usually through a endoscopic release. But the natural history is it gets worse, so there's nothing that is going to make it better unless you can increase the space for the nerve.
What happens if I leave it untreated?
I think I pretty much hit that, but the natural history is it gets worse over time. It can be slow, it can be fast. Sometimes you don't get that much sensation problems because the nerve has got motor and sensory fibers. So if you hit the sensory fibers, which is what happens usually, people go numb, wakes them up at night, drives them nuts. Sometimes it doesn't. You can get atrophy, like the muscle here, the base of the thumb can die. You get clumsiness, weakness, and dropping things without too many sensory symptoms. And that happens, and it's progressing, but it hasn't really got to the point where it gets that numbness that drives you crazy. So you don't know it, and that can actually be more damaging. But Repeat it one more time.
What happens if I leave it untreated?
Yeah, you leave it untreated, it gets worse, and that's unfortunately the natural state of it.
Thank you very much.